I was very surprised but pleased when I was asked to speak at the Croydon Healthwatch AGM. It's 9 months now since I retired from my post as Executive Director in the Council, and I'm certainly not speaking for the Council, I'm certainly not speaking for the CCG, and indeed I have to own up that I'm probably not fully up to date with everything that's going on. I mean, things change dramatically. You know, change is constant, and things are always changing. It's 9 months now since I retired, and I've also learnt that waters soon close over once the leaving speeches are over, and one is relegated to organisational history. Indeed, if one is lucky to be remembered at all. I'm also not speaking formally on behalf of the Opportunity and Fairness Commission, although I am an independent commissioner on the Commission. So what you're getting is some of my own personal thoughts and views on the opportunities and challenges facing health and social care, and how Croydon might be equipped to deal with some of those. I will also touch on some of the opportunities for the residents of Croydon to make their voices heard on these key issues, and obviously Charlie has already spelt a lot of those out in detail. I've always been a pretty optimistic, glass half full kind of girl, so think that challenges, however tough, bring opportunities, just as opportunities bring their own challenges. Many of the challenges facing the health and social care economy in Croydon are not unique, and they're shared with economies up and down the country. Unprecedented reductions in council budgets, the NHS making huge efficiencies despite some growth, demographic demand, particularly growth in the older people's population, more people living with dementia, more people living with multiple long-term conditions, more children needing support with mental health problems. With particular reference to Croydon, unfortunately, increasing levels of deprivation, increasing homelessness, increasing mental health needs, including anxiety and depression, high rate of emergency admissions to hospital. To my mind, we have some big questions to find answers to if Croydon is to succeed in further improving the health and well-being of its citizens. These, what I'm going to talk about, are very much a self-chosen selection, and I'm sure you will think of other questions just as important. So my starters for 10, I don't think there are quite 10, but my starters for 10 are anyway. How do we maintain and indeed improve the quality of the user experience in the face of rising demand and depleted, or at the very least overstretched, budgets? How do we go about influencing and changing expectations of service users, patients and their families, i.e. us in this room, away from a culture of needs and rights to one of an asset-based culture of increased personal, family and community resilience? How do we influence and change the culture of health and social care professional staff to work with individuals and families to foster the development of personal assets and resilience, encouraging maximum self-management of conditions and enabling people to maximise their personal independence? How do we change the way we train and develop our health and social care workforce so they can work in an outcome-focused way with service users and patients? How do we move resources downstream into the community to pump prime more creative, preventative, personalised services which in the longer term will reduce the demand for expensive hospital and residential and nursing care without destabilising the system of care that we've got at the moment for the highly dependent? How do we maximise the use of assistive technology, telehealth and telecare, to help people maintain independence in their own homes and also utilise assistive technology in residential and nursing care homes to avoid unnecessary hospital admissions? How do we harness digital technology, including social media, to help prevent social isolation? Social isolation is one of the key themes that the Opportunity and Fairness Commission is concentrating on around the whole area of health and well-being. I constantly hear people say that OAPs like myself are not capable of learning new computer skills. Tell that to my housebound 78-year-old sister-in-law who's losing her memory but still manages to conduct Facebook debates with new, in quotes, friends, half a century younger than herself, Mind you, that gap is partly bridged by her Facebook photo being one that she took in her 20s. Seriously, you know, my white-haired sister-in-law in her photograph is a stunning, long-haired redhead. There are no easy answers to these key challenges, but in my opinion, Croydon has good a chance as anywhere in the country to come up with creative solutions to these questions and to turn challenges into opportunities. It's certainly not all bleak, and that's the question I want to, I think there is a real danger, as Nikki said, that we always go for the negatives and that we don't actually go for the positives. So there has to be a balance. So what's Croydon got going for it? Coterminous boundaries for the council, the CCG and CHS, which cover both acute and community services, and that's really important. I'm doing work in other parts of the country at the moment, and people would bite at the hands to actually have the coterminosity that you've got here in Croydon. If you've got counties where you're perhaps dealing with 3, 4, 5 different CCGs, 3, 4 different hospitals who take people from Solihull, Birmingham, Dudley, it's a nightmare. And you've got coterminosity here, so make the most of it. A long history of partnership working across agency boundaries, including integrated commissioning. Partnership groups, and I was lovely to hear Nikki say that the LD partnership group was going from strength to strength. I hope all the others are as well. But partnership groups that have been going on for years with really strong service user and carer engagement. Croydon is undergoing massive regeneration. Regeneration will mean more homes and jobs which will feed through to improved health. And very much good homes, employment, good education are very much at the backstop to determinants of good health. A robust, diverse voluntary sector prepared to work together. I visited Charlie the other day in the Carers Hub in George Street, and to see all the different doors in that building with the different organisations' names on it was a real pleasure. I think, to be honest, if and I know Margaret Mead, who was cabinet member at one point with me, if you asked me what was one of the real successes of my 17 years, is that I had wanted right from the start to have an integrated carers centre, and the fact that we achieved it in the last year or two before I retired is fantastic, and very much thanks to the Whitgift Foundation. But within that, you've got the Carers Hub hosting different groups. You've also got things like Age UK, Mind, Disability Croydon, and other organisations working together around joint advocacy. And again, I think that's very much a plus for Croydon. There's a rich tapestry of community and faith groups with some excellent examples of support for vulnerable individuals. For example, the winter night shelters provided by churches in the south of the borough. Another example is the Neighbourhood Care Association, with around 30 affiliated local groups who do wonderful work to prevent social isolation for vulnerable people. A real willingness in Croydon to do things differently, and I think I'd probably cite the work going on in New Addington with CVA's ABCD Connector Community. I think that's the correct, looking at David, I think that's the correct title. And I feel very strongly, if some of the thorny questions I posed earlier, and which I'm posing to everybody, not just to the statutory agencies, if these are going to be addressed, we need to reinvent community development on a much wider scale to enable communities to tap into their own assets and their own resources as a key part of improving well-being. When I first came to Croydon, the first time round, which is probably more like 25 plus years ago, there were teams of community development workers and community workers actually working with groups and with communities. And I think we've lost a lot of those skills, and I think we do need to reinvent them. The council and the CCG, and this really is my one big delight, particularly as I'm over 65 and it really does affect me, which is the council and the CCG moving towards commissioning all health and social care services for the over 65s in order to deliver improved health and wellbeing outcomes at a population level, and working with providers that include Croydon Health Service, South London and Maudsley Trust, Age UK representing the voluntary sector, the GPs joining themselves into a collaborative, and also the Council's Adult Care Assessment and Case Management Service. It's essential that this high-level approach to commissioning goes hand in hand with bottom-up working with individuals and their carers to achieve personalised outcomes which promote resilience and independence for the individual and for their carer and their family. Vanessa mentioned the CQC inspection of Croydon Health Services, which was published yesterday. So I would see as a plus is that you have got an improving hospital and community health trust, an integrated acute and community trust. And I think the report says that significant progress has been made since the last inspection in 2013, and highlights, I think it's something like 13 outstanding services within the hospital. So still a way to go, still, you know, a year or two off being good, but I think the fact that the trust was assessed as being caring and effective is a real tribute to the work they've been doing in turning around the culture of the staff in the hospital and to the staff themselves. Another positive I see is strengthening primary care around the 5 GP networks, with multidisciplinary teams already working with social workers and nurses working with GPs to avoid people being unnecessarily admitted to hospital. There are also, as I understand, plans to improve the alignment of community mental health services with the GP networks as part of additional CCG funding of mental health in the borough. The Better Care Fund has had mixed press, I think, nationally, but it has been an attempt to pool investment to reduce emergency admissions to hospital through improvements to community-based health and social care services. And this is a major, I think both Charlie and Vanessa talked about integrating health and social care. And I think the Better Care Fund and the plans around the Better Care Fund and the pooled investment is a major vehicle in moving towards that integration of health and social care and the provision. I know it sounds a bit of a hackneyed phrase, but 20 years ago in social work we were talking about seamless services, and it sort of seems to be that holy grail that you know moves further and further away from you. And I think hopefully the Better Care Fund is actually going to be really important to the provision of that seamless service. It was interesting, Charlie talking about the enter and view. It sounds a bit like an estate agent, doesn't it? Last night when I was, desperately in my slow typing of I thought, I really am too tired to go back and check your annual report to check what the correct terminology is. It can't be enter and view, but it is. So I had got it right. We have actually got the large and diverse care home market in Croydon, the largest in London, and very important is the role of the joint care support team in working with homes where there are safeguarding or quality care issues. This is a small team funded by the CCG and by the council, where they go in where there are issues to work with homes to try and bring them up to scratch. And there are real opportunities with this very large, diverse residential and nursing home market for the council and the CCG to work with providers to shape the market and to ensure that actually they do meet the needs of Croydon residents for both quality and value for money. And I know Healthwatch will be behind them all the way, watching what's happening. So lots of good things happening in health and social care in Croydon, with more initiatives planned which will help to meet the challenges of the system, which I spelled out earlier in my presentation. A key message that I do want to emphasise is that what's happening locally in health and social care is important for the well-being of the whole community, and that means you, me and our families, our neighbours, the wider community. It's far too important to leave solely to the professionals, and I can say that now speaking as an ex-professional. We need to have our say on the direction of travel and the quality of the user experience and make sure our voices are heard loud and clear. Croydon Healthwatch is a key vehicle for getting the views of local residents heard on their experience of local services, and then have these represented back to the statutory agencies. User views are then formally represented by Healthwatch sitting on the Health and Wellbeing Board that's been mentioned, but also the Council Scrutiny Committee, the Adult Safeguarding Board, and I hadn't quite realised that you were only honorary members of the CCG governing body, so I'll have to change my script on that one. Other ways of getting our voices heard is through, and we shouldn't undermine or underuse this, the statutory complaints and suggestion procedures of both the NHS organisations and the council. How we feed into the CQC inspections of hospitals, care homes, GP practices, dentists, etc., when we're asked our opinion, we need to give them. And obviously, of course, the Healthwatch's enter and view functions. The PALS service at the hospital, the patient, I'm sure I haven't got the terminology right, so please excuse me, but the patient for at GP practices, CASUP, and a number of you here are from CASUP. I can't for the life of me remember what it stands for, but I know it's got panel at the end, and social services somewhere in the middle, but it plays the critical friend role to adult social care, and that's really been a very, very important function. Partnership groups I mentioned, and there are user and carer representatives of voluntary organisations on all those partnership groups who are happy to represent views and to take views forward. The public consultation events, I have to say, one of the best for years. I mean, I remember the open space events that we used to run for older people, lots of things that have gone on, the LD conferences, all those kind of things that we've run over the years. I think it was called the Inclusive Forum, it's now called something different. Those were really, really important ways of getting the voice of service users through to the statutory agencies. But I really wanted to dwell on the public consultation event at the Council and the CCG, which really was one of my swan songs before I left, which was in the autumn for the over 65s, where over 450 older people were actually engaged in what they saw as being the outcomes they wanted from health and social care. And the challenge now is for the and the CCG in doing that recommissioning of those services to make sure that those outcomes are not only built in, as I said, at the population level, but also that there's very clear ways for how the individual feeds through to the service, feeds through to the actual population level. I also, and I would say this, wouldn't I, having managed housing in Croydon for the last 7 years or so, but the number of residents and tenants associations which are engaged and involved with so many people in the borough is a real positive way of getting views, again, fed through to all the agencies. And I wouldn't forget advocacy. A number of the voluntary sector organisations advocate for individuals and advocate for views. And last but not least, the public questions. The council takes public questions at its meetings, the CCG governing body does, the trust boards for CHS and SLAM, and also the Health and Wellbeing Board. I'm also going to give a strong plug, because I can't forget that I am an independent commissioner on the Opportunity and Fairness Commission, a strong plug for the interim report, which is due out in about the next week or two. I think it's around the 15th of the month. Your people are that are nodding. And we'll be asking for all the views and ideas on how we can make Croydon a better place for all our citizens in terms of, making Croydon really, so much has been done in Croydon, but it's about how can we come up with new ideas to push it even further. There ain't the money to have loads of new investment. So we've got to make the best of what we've got, we've got to change what we've got to transform what we've got and actually get those better outcomes for the public. So please keep your eye out for coverage in the local press. The final report from the Commission is due in January, so there will be at least a 6-week window for more contributions and ideas on how to do things differently from the public. So it's important that our voices are heard. We can influence changes to services and the development of new services. Ideally, any change or development should be co-produced with patients, service users and their carers. And I've already apologised to Nikki if over the years I did on occasion forget that. I do apologise that. But professionals don't have the answers. They don't have all the answers. They're obviously an important part of the answer. They don't have all the answers. Commissioners and providers need to positively reach out to us, the community, and we need to respond using the methods that suits us from the above list that I've talked about, and that's certainly not exhaustive. So thank you for letting me share my thoughts with you. I'm happy to take questions or indeed thoughtful contributions. If I don't have the answer, I'll rely on other people in the room to help me out. Or indeed, if nobody in the room's got the answer, we'll rely on Healthwatch finding out the answer and then getting back to people. Thank you.